our Os Coxae bone. This is a left Os Coxae, or a pelvic bone. This right here is our anterior view. We have our posterior here. This is our medial, our lateral, our superior, and our inferior. Okay, so the pelvic bone is made up of 3 bones fused together. So we have up here, 2/5 of the pelvic bone is made up of the ilium. Another 2/5 is made up of the ischium. And the last 1/5 here is made up of the pubis. Now, these 3 bones fuse together here in what's called the acetabulum. Here in the acetabulum. The acetabulum, where this tape is right here, has this surface called lunate surface. And where I'm putting my finger right here, this is called the acetabular notch. So this that I'm grabbing right here, this whole thing, this is considered the iliac ala, the wing of the pelvic bone. This gold up here on the superior view, it is called the iliac crest. Then on the lateral side here, this pink is our iliac tubercle. Underneath our iliac tubercle, this dark blue is our iliac pillar. These 2 that we have here, these 2 bumps on the anterior side, is called our anterior superior iliac spine and our anterior inferior iliac spine. In between them, we have our iliac notch. Now, on the posterior side, we also have 2 bumps. The top bump is our posterior superior iliac spine, and then here we have our posterior inferior iliac spine. Going back to the lateral side here, these 3 lines are all gluteal lines. This top one here is our anterior gluteal line. This one here is our inferior gluteal line, and the one in the back is our posterior gluteal line. Right here on the posterior side of the ilium, we have this big bump right here. This is called our iliac tuberosity. If we go down this way, right here in between our ilium and ischium, we have here our greater sciatic notch. Now, going on the medial side of the ilium, these structures here. This big red circle right here is our iliac fossa. This right here is called our auricular surface. This pink one here is called arcuate line. This dark blue one here is our iliopectineal line. All of these structures that we just talked about, including this part of the acetabulum, makes up the ilium bone. Now we will talk about the ischium, which is 2/5 of the pelvic bone, or the Os Coxae bone. So, starting right here, this orange, it's a groove. This orange groove is called groove for obturator internus. Underneath it, right here, this is the posterior side of the bone. So this right here is our ischial tuberosity. It's a big bump. Ischial tuberosity. Moving up from our ischial tuberosity on the posterior side, here in this gold, this is our lesser sciatic notch. Above the lesser sciatic notch, still the posterior view, we have the ischial spine. Now going back on this lateral view, this red right here goes all the way around. That is our ischial ramus. So all of these structures, including this part of the acetabulum makes up our ischium bone. The last bone we have, which is the 1/5 of the Os Coxae bone, is our pubis. So it includes this red area here and everything that I'm going to talk about now. So, starting here on our anterior view, this yellow right here is called our iliopubic eminence. This blue right here that goes all the way around, that is our superior pubic ramus. Our inferior pubic ramus is this hot pink right here. It goes all the way around here, inferior pubic ramus. Now on the superior pubic ramus, underneath, we have right here, obturator crest. And this purple right here, that it goes under and basically around a little bit, that is our obturator groove. Now, going back to our anterior view on the edge over here, this is our pubic tubercle. Going on the medial side here, this orange one is called our pecten pubis. And this green one is called the pubic crest. And lastly, this gold, this is representing where our symphysis pubis would be, which is the cartilage that connects both of our pelvic bones together. So all of these structures that we just went over make up the pubis bone. All of that, those three bones combined, make up our Os Coxae bone or our pelvic bone. Here we have the patella. It is in the anatomical position. We have the proximal, the distal, and then we have the lateral, the medial, the anterior, and the posterior. This is a left patella. Now, the structures that we have, the top is the base of the patella, and the bottom pointy part is the apex of the patella. Turning it on the posterior side, we have two facets. The larger facet is the lateral facet, and the smaller facet is our medial facet, and that is the patella. Here we have the femur in the anatomical position. This is a left femur, so we have the medial, the lateral, the anterior, the posterior, and then we have the proximal and distal. Now, we're going to start up at the proximal end up here. Facing medially, this yellow right here all the way around is the head of the femur. Head of the femur. Right here in the center of the head, we have fovea capitis. This green, all the way around, we have the anatomical neck of the femur. This blue right here, which we can see a little bit more of on the posterior side. So this whole entire blue, this is our greater trochanter. The pink underneath here, pink right here, this is our lesser trochanter. Now on the anterior side, this in between the greater and the lesser trochanter, we have the intertrochanteric line. On the posterior side, in between the greater and the lesser trochanter, we have the red right here, intertrochanteric crest. This orange that is on the crest, this is called quadrate tubercle. Now, if we flip the femur so that the medial side or the head is facing us, deep in there, that dark blue, that is called trochanteric fossa. We have a fossa in here, trochanteric fossa. So we are on the posterior side of the femur, and underneath the greater trochanter, we have here gluteal tuberosity. And then basically diagonal from the lesser trochanter, right here, we have pectineal line. We have here, this is our spiral line. Now moving down for the shaft of the femur, we have the linea aspera, which is basically the posterior border. There are 3 lines that make up the linea aspera, or the posterior border. So the first line we have is the medial lip. So this red right here, because this is our medial side, we have this red, our medial lip of the linea aspera. This orange right here is our intermediate lip of the linea aspera. And we have this neon orange on this side. This is our lateral lip of the linea aspera. So those 3 lips make up the linea aspera. Moving on to the medial border of the femur, we have here this blue. This blue goes all the way down, medial border of the femur. And then on the lateral side, this pink right here, this is our lateral border of the femur. Now for surfaces and borders are opposite of each other. So if these 3 make up the posterior border, across from this here will be our anterior surface. All of this are anterior surface. Going back on the posterior side here, we have our medial border. So opposite of that right here, it's very small. In between this orange and pink will be our lateral surface. And then this pink right here is our lateral border. So it'll be opposite of it right here. In between the blue and the red, we have this surface right here, and this surface is our medial surface of the femur. Moving down the femur, this green area right here, this is called our popliteal surface. Popliteal surface on the posterior side of the femur. Now, turning the femur medially, so this is our medial side, we have this orange right here. It comes off basically of the medial border, continuing on here. This is called our medial supracondylar ridge right here. We also have a lateral, here we go, lateral supracondylar ridge here. In this basically dip right here, this is called the intercondylar fossa. And on either side of it, we have the condyles. So our medial side once again is here. So this big blue area right here, this is our medial condyle. And on the lateral side here, we have another blue. This is our lateral condyle. The yellows on each of the condyles, so this is our lateral side, that yellow is our lateral epicondyle. And if we turn the femur on the medial side, from our medial condyle, in the center of it, we have our medial epicondyle here. Now, on the medial side, once again, this pink is called adductor tubercle. On the medial side, adductor tubercle. On the lateral side, we have this groove right here. This groove is called the popliteal groove on the lateral side. To finish off the femur, on the anterior side of the femur, we have right here this orange area right here. This is called our patellar surface on the anterior side of the femur. So all of that concludes our femur. Here we have our tibia. This is a left tibia. It is in the anatomical position. We have the proximal, distal, medial, lateral, anterior, and posterior on the back. We're going to start on our more proximal end, and I'm going to turn it up like this so we can see the proximal. Now, these green that we have here, these are our condyles. So, this green one here on the side of our malleolus down there is our medial condyle. And then we have our lateral condyle right here, which is this green. On top, these oranges right here, these are plateaus. So we have our medial tibial plateau and our lateral tibial plateau. In between, we have this pink area. This pink area here is our intercondylar eminence. And we have a medial and a lateral tubercle. So we have medial tubercle and lateral tubercle. Then, since this is the anterior side here, we have here anterior intercondylar fossa. And in the back, posterior intercondylar fossa. Now, on the anterior side of the tibia, we have this big blue area. This is our tibial tuberosity. Then next to it, right here, still on the anterior side, this area here is called Gerdy's tubercle. And it is on the lateral side of the tibia. On the medial side of the tibia, it has here these three colors all together. So, those three colors all together are called pes and serenus. The pink one in particular is representing where the sartorius muscle would insert. The orange is showing where the gracilis muscle would insert. And the gold is showing where the semitendinosus muscle would insert. All together, they are pes and serenus. Following our tibial tuberosity, going down, is our anterior border. We have here, this dark blue, is our medial border. And then on the other side here, this orange, we have our lateral border. And surfaces are opposites of borders. So if we have our anterior border here, our posterior surface will be back here. And if we have our medial border here, medial, we will have our lateral surface right here. And if we have our lateral border here, we will have our medial surface right here. Now we have the tibia in the posterior view. So going up here, the proximal, on this more lateral side, up here we have this fibular facet. This is where the fibula will articulate with. On the posterior side of our tibia, on the medial side right here, more proximally, we have here our groove for semimembranosus. This pink right here, groove for semimembranosus. Then This diagonal tape right here is called our popliteal area. Next to it, right here with this gold, it is called the soleal line. Then this line that is going straight up and down is called the vertical line. Now we're going to move down distally on the tibia, and we're on the posterior view, but this is the more lateral side. So laterally, we have here this fibular notch. If we turn on the medial side here, this pink is our medial malleolus. This green that comes near it is called the medial malleolar sulcus. And lastly, underneath the medial malleolus, right here, we have medial malleolar facet. And that concludes our tibia. Here we have our fibula. It is in the anatomical position with the proximal end, the distal end, the lateral, medial, anterior, and posterior. Now, I will show you what it looks like with the tibia next to it so you can orient yourself. So this is the tibia and fibula together. This is a left tibia and fibula. So they look like this together. Now we will go over the structures of the fibula. So on the proximal end, this whole thing that I'm grabbing with my fingers is the head of the fibula. On the head of the fibula, this blue right here is our styloid process. It is more on the lateral side of the fibula. And then we have this orange right here, that is our tibial facet. This is what will articulate with the tibia. So this is our tibia in the posterior view. So I will show the fibula in the posterior view, and matching them together, that tibial facet will articulate with this fibular facet right here. So they will sit just like that, touching there. Then we have this green around here, which is the neck of the fibula. Now going down here, this edge is our lateral malleolus. This blue right here, lateral malleolus. Going on the medial side of the fibula, right here, in here we have a little indentation. So this is our malleolar fossa. It is on the medial posterior aspect of the fibula. So when you're orienting yourself, this malleolar fossa needs to go posterior and facing medially. Then we have this blue right here. This blue is the lateral malleolar facet. Lastly, we will do the borders and the surfaces of the fibula. So on the side of the lateral malleolus, going straight up here, this yellow is our anterior border. Anterior border of the fibula. Our medial border is here. This green is our medial border. It is also sharper than the other borders. And lastly, our posterior border is on the back. Posterior border is on the same side that you can see the malleolar fossa. The surfaces are opposite of the borders. So if we have our anterior border on the back over here, we will have our posterior surface in between the pink and green. If we have our medial border here, the green, our lateral surface will be here in between the yellow and pink, lateral surface. And then we have this posterior border its anterior surface is in between the yellow and green right here. Anterior surface. And that concludes the fibula. Here we have the foot. It is an anatomical position. We have the superior, the inferior on the bottom. We have the medial on this side, the lateral, the anterior, and the posterior. I will turn so that the posterior is facing us, and we will start with the tarsals of the foot, which have 7 bones. The first one we will talk about is this one, surrounded in green. All the way around here, all the way back here. This one is called, whole thing, the talus. This is the talus of the foot. Okay, talus. Now, this purple part here is the trochlea. On either side of the trochlea, we have medial and lateral malleolar facets. Then we have medial and lateral tubercles. So that is on the posterior side of the talus. So that is our orange right here. We have our medial tubercle of the talus and our lateral tubercle of the talus. In between them, this blue, that is called groove for FHL, right here. And lastly, the talus has a head, a neck, and a body. So the talus goes all the way up to this crack right here. Let me get these. So basically, this part that I did not tag, this is the head of the talus. Where this green is, basically, is the neck of the talus. And the rest of it is the body of the talus. Next, we have the calcaneus. Calcaneus is surrounded in pink. All of this that I'm holding is calcaneus, okay? Now, we have a calcaneus tuberosity, which is on the posterior side. So this gold right here is our calcaneus tuberosity. Underneath, on the inferior side, right here, these right here, these are called tubercles. And so, on the side of the big toe right here, we have our medial tubercle of the calcaneus, and then we have our lateral tubercle of the calcaneus. Still looking at the foot from the inferior view, moving more towards the medial side, we have here this yellow part of the calcaneus. This is called sustentaculum tali. This groove that we have next to it is called the groove for FHL of the calcaneus. Lastly, on the calcaneus, on the lateral side, this yellow right here is our fibular trochlea, and that is the calcaneus. We have here this bone called navicular. Navicular is this whole thing that I'm pinching is navicular. Navicular has this little end right here, which is called the navicular tuberosity, this orange. Then we move on to the cuboid. Cuboid is on the lateral side of the foot, basically past the calcaneus. This is our cuboid bone. Underneath the cuboid, this is still orange, all of this should be cuboid. This red right here, that is called our fibular groove. Fibular groove of the cuboid. This green is called oblique ridge. Going back on the superior view of the foot, we have these three bones all together right here. Starting medially, this first one, this yellow, is called the medial cuneiform, or also the first cuneiform. Then the one in the middle is called our intermediate cuneiform, or the second. And then this one here is our lateral cuneiform, or the third. Now, those were all of our tarsals. Moving up to our metatarsals, we have here metatarsal 1, metatarsal 2, 3, 4, and 5. On metatarsal 5, the very bottom here, we have this little part that sticks out. So that is called tuberosity of 5th metatarsal. Now for each metatarsal, we have a head, a shaft, and a base. Head, shaft, base. Then, moving up past the metatarsals, we have just the phalanges. We have the same format that is in the hand we have in the foot. So, toes 2, 3, 4, and 5 all have 3 phalanx, while toe 1 only has 2. So, they all have a proximal phalanx, and they all have a distal phalanx. However, toes 2 through 5 have a middle phalanx also, which is right here, middle phalanx. Toe 1 does not have a middle phalanx, only a proximal and a distal phalanx. And that concludes our foot.